Assalamu alaikum. Welcome back to Daniyal Ultrasound Clinic. This is Dr. Munir Abbasi presenting a case of gallbladder obstruction by stone in the neck or cystic duct area with two free gallstones in the gallbladder neck, as you can watch here. So I'm going to share with you an interesting ultrasound case of a moderately distended gallbladder showing features of obstruction due to impacted stone, as I told you, in the neck region or probably in the cystic duct area. So we'll discuss its appearance, ultrasound findings, and how to differentiate it from other similar gallbladder pathologies. So let's start with the longitudinal section. This is the longitudinal section of the gallbladder at the right upper quadrant of abdomen. Here you can clearly visualize the gallbladder. It appears moderately distended with a thin to mildly thick walls and anechoic gallbladder lumen, but it isn't anechoic. In this scan, it appears anechoic, but there are few free-floating echoes, which I'll show you later. So now when we move our probe gently, we notice how two free-floating echogenic foci are seen within the gallbladder lumen. You see here. Here are two free-floating gallbladder stones, casting posterior acoustic shadowing. We can describe them as echogenic foci, casting posterior acoustic shadowing, strong posterior acoustic shadowing, suggestive of two gallstones side by side here, 1 and 2. The gallbladder here is distended. Now look carefully at the neck of the gallbladder. Here there is one fixed echogenic focus, which I am going to show you just now. Here, yes, here it is. This echogenic focus is fixed and lodged deeply in the gallbladder neck or cystic duct area. Unlike the free gallstones, this one does not move with the change in the patient's position. So it also shows a distinct acoustic shadowing, confirming it is a calculus rather than silage or any other solid mass. So this stone is likely causing partial or complete obstruction, leading to the moderately distended gallbladder lumen. So in cases like this, when the cystic duct or neck is blocked by the stone, bile cannot exit properly, so resulting in gallbladder distension and sometimes mild wall thickening, which is here. I can show you. Here is the gallbladder wall thickening. You see here, this is the gallbladder wall. This is gallbladder wall, which is showing thickened all over. Now, if the obstruction persists, it can progress to acute cholecystitis or mucocele formation, which has taken place here. There is mucocele as well as gallbladder silage is getting accumulated in the gallbladder lumen, which is not though in a copious amount, but the process is underway. So, with the more careful view, we can also visualize here little bit of here pericholecystic collection development. So this can be labeled as gallbladder stones There are two free gallbladder stones in the lumen. One of them has lodged into the gallbladder neck or cystic duct area, which is causing obstruction, partial or complete. And there is also signs of cholecystitis with slight or streaks of pericholecystic collection, and this may be labeled as a hydrops of gallbladder when the distension is marked and the bile appears clear and anechoic. But this is there's bile is not very much clear. It contains few internal echoes which are free floating. So now to summarize, once again I repeat that gallbladder is moderately distended with two mobile free gallstones. One of them has been lodged in the neck or cystic area causing obstruction, and there's sign of inflammation as well as the impression would be ultrasound features are consistent with obstructed gallbladder due to impacted calculus at the neck of the region. So we can again go to the neck and see here the gallbladder stone, which measures approximately 1.1 centimeters. So if you found this case educational, please do not forget to like, share, and comment and subscribe to my channel for more real ultrasound cases. Thank you very much and see you again.